You are watching McLaren Port here on Today's Health, and in today's program, I'm speaking with fellowship-trained orthopedic hand and upper extremity surgeon, Dr. Devin Banda, about conditions that affect the hand and upper arms. And in this segment, we're talking about arthritis and tendinitis. Dr. Banda, can you explain to our audience just generally, what is arthritis?
Yeah, so arthritis is an extremely common condition that typically involves wearing of the cartilage lining of two bones that articulate at a joint surface. And when you have wear down of that cartilage, you get some inflammation in that joint, which can generate pain and limited range of motion and stiffness.
And how does that differ from tendinitis?
So tendinitis typically is more of an inflammatory process around or involving the tendons, really in any portion of your body, from your toes all the way to your fingertips.
And so we were going to talk a little bit about arthritis specifically affecting the thumb. Can you explain how that impacts patients?
Yeah, so arthritis at the thumb, and in particular actually at the base of the thumb, is one of the most common areas that we see arthritis in the hand, secondary or just kind of second in line to arthritis in the small joints of the fingers. And it's one of the most debilitating arthritic conditions because we use our thumbs with nearly almost everything we do. So if patients are having pain with pinching, grip strength, a common cause of that is arthritis at the base of the thumb. It's more commonly seen in women, but is also seen in men. And a lot of patients, as they age, actually develop this, and it really kind of varies from patient to patient whether they're symptomatic from it or not. Typically a diagnosis is made just with simple physical exam, as well as x-rays, which would reveal some arthritic changes at the base of the thumb. And the kind of treatment modalities for it really are a wide array of things, from non-operative treatment starting off to more surgical types of intervention, depending on the severity and the duration of symptoms.
So like the non-surgical options, so we would start like maybe with some anti-inflammatory medications? Yep,
absolutely. Yeah, we always start with conservative treatment, really with any condition that we're approaching. And typically it consists of anti-inflammatories, any type of bracing, and sometimes we can even do steroid injections into that joint to try and calm down the inflammation and give some patients pain relief.
So what would the surgical options be?
So a surgical option is a little bit bigger of an operation in terms of hand surgery. It's a little bit more complex than your average carpal tunnel, but it's a really great, useful tool as a hand and upper extremity surgeon to have in their toolbox, mainly because it provides great pain relief from that thumb arthritic pain that patients experience. And there's a lot of different ways to do the surgery, but typically the general consensus and the most important part of the surgery is actually removing part of the bone that is arthritic that causes the pain. And then there's a lot of different ways to redesign the thumb joint to create a more functional and pain-free thumb.
And what would the recovery look like for a procedure like that?
Yep, so recovery, typically the way I do my particular procedure is usually around 3 weeks of immobilization. And then at that 3-week mark, we get you working with a therapist, and then start working on gentle range of motion. And then around the 6-week mark, we start working on more strengthening. And then every patient is a little bit different on the timeline. But usually it's a few month recovery before you really start having a lot better function of your hand.
Yeah. So let's move on to wrist arthritis. What kind of symptoms would someone experience?
Yeah, so kind of similar to the thumb, wrist arthritis typically will present with swelling and pain with any type of movement with the actual wrist. It can be caused by either traumatic injury or more of inflammatory type of arthropathies like rheumatoid arthritis or gout or pseudo-gout. And diagnosis is kind of similar to other arthritic conditions where it's based off your physical exam and imaging.
Yeah. And is there any surgical options for wrist arthritis?
Yep, yeah, there's surgical options for wrist arthritis in more kind of advanced stages of the disease. Typically we start out with more non-operative treatment with anti-inflammatories, steroid injections, splinting, and then if those modalities fail, there are other options depending on the type of wrist arthritis that you have, and those typically involve either partial fusions or fusions of the actual bones, which basically eliminates the movement between the bones with some sacrifice of range of motion, but at the benefit of pain control.
Very good. What about hand arthritis? Is that very common?
Yes, hand arthritis is very common. That's actually the most common area of arthritis that we see in the hand, particularly in the small fingers or in the small joints of the digits. And those are typically managed for the most part non-operatively with anti-inflammatories and steroid injections, and those two modalities usually work pretty well for most patients.
When I think of hand arthritis, think about the pictures like patients with rheumatoid arthritis and the curved fingers. Is that very common?
Yeah, so fortunately, the deformities that we used to see all the time in rheumatoid patients are becoming less and less common due to the advances in the drug therapy that we have to treat rheumatoid. But people still are out there with advanced rheumatologic arthritic changes, and there are options for those patients as well.
Very good. So we want to talk a little bit about tendons too. So can you tell us trigger finger? I think that's what comes to mind.
Yep, yeah, so trigger finger is for more or less a form of tendonitis. And the kind of reason why it happens, we don't exactly know, but typically it's involving inflammation of the tendon, and particularly with trigger finger, the tendons, or we like to call them the puppet strings that kind of move the fingers, they travel in a tunnel. And if those tendons become inflamed and they don't have enough room to glide smoothly through the tunnel, you can kind of get catching, clicking, pain, and inflammation along that flexor tendon sheath, and that's what causes kind of the locking or the triggering of the digit.
Yep. So the finger will actually be like stuck in a position, or it'll like a trigger.
Yeah,
right?
exactly. Yep. Yeah, that's why they call it trigger finger. But yeah, it can be locked where you kind of have to passively extend it to try and correct it, which can be extremely painful.
Yeah. And how is that treated?
So that's treated typically pretty conservatively initially. We always will typically try just anti-inflammatories or possibly even a steroid injection to try and calm down the inflammation locally. And sometimes we can try the steroid injections really 2 to 3 times maximum. And if it's still coming back but you're getting less and less relief from that type of intervention, then the surgery to fix that is a relatively pretty quick and straightforward surgery where we just go and release the sheath that the tendon is traveling in, and really let you have unlimited range of motion directly after surgery.
Are there other common tendon conditions that you see?
Yep, yeah, so that kind of same tendonitis type of disorder is commonly seen in the wrist as well, in a condition that we call de Quervain's, which is inflammation more so on the radial portion of your wrist, and it's kind of a similar method of inflammation that is generated there, where there's not enough room in the tunnel that they travel, and they become inflamed and painful.
Very good. And how is that treated?
So that's treated very similar to trigger finger. We can start off with injections, anti-inflammatories, and if you fail those conservative treatments, there is a small surgery where we can release that compartment and let the tendons glide freely, and just a brief period of immobilization afterwards, and we try and get you moving as soon as possible.
Great. Thank you for sharing this information with our audience.
Thank you so much for having me.
And please stay with us. We will continue our discussion with Dr. Banda after these messages.